Hello everyone, and welcome back to Parenting is a Lifestyle. This is part 2 of a 3-part series on functional constipation. In our previous episode, we discussed what functional constipation is and how and why it happens. So check back to learn more about this if you haven't done so already. In this part, I will be addressing some common misconceptions and discussing some parenting and lifestyle strategies that can be implemented to build healthy bowel habits for both the prevention and the treatment of constipation. As always, this is general information. It is not intended as medical advice, so it should not be taken as such. And if you have specific questions about your health or your child's health, discuss with your own doctor. On the Parenting is a Lifestyle podcast, we focus on the importance of healthy habits right from the start of a child's life. However, we also emphasize that it's never too late. When we as parents understand the impact of our decisions on our children, we may be more likely to make positive lifestyle changes to reflect those priorities. While there are no guarantees in life, we can only do the best that we can with the knowledge and the skills that we have at any particular given time. This way, we can improve our own health and our children's health and quality of life. When we know better, we do better. So it's important to give ourselves compassion and grace as we navigate this learning curve, to show up with a growth mindset as well. I'm Dr. Richa Agnihotri, a community pediatrician, board certified in lifestyle medicine, and today we will be continuing the conversation about functional constipation. So let's dive in. What are some common misconceptions that I see in my clinical practice? To highlight these, I'm going to pose some questions to you. Number 1, this is true and false. My child poops every day, so they cannot be constipated. This is actually false. Children who poop every day can still be constipated, and that's because there are many other factors involved. That includes the type of poop, so whether it's solid or soft and where along that spectrum of solid to soft it is, whether it's easy to pass or that there are any other symptoms associated with it. Have you heard of the Bristol stool chart? If you haven't, check it out, and I will link it in the description as well, and you can check out our website for more information. And if you haven't joined our newsletter, join it, because I will be sharing some more information about constipation in that newsletter. So we had a Bristol stool chart up in our kids' washroom at some point, and they'd identify what type of stool they'd had, which was a great way to encourage them to build a connection with their stool, their body, so understanding that fullness feeling and then the empty feeling after they went, and even internal motivation where they would look at the type of poop that they passed, point to it on the Bristol stool chart and say, I passed this type of poop, how exciting. So the aim is that you want to pass one type 4 to 5 stool daily. That is something that many kids describe as, comes out like butter or was smooth as a snake. One of my preceptors or mentors actually told families to aim for a soft serve ice cream type poop every day. Okay, so on the Bristol stool chart, there are 7 types of stool. And type 1 is hard rabbit pellet poops. These are hard to pass. They are often small. And type 2 is where it's more formed and there are more hard clumps that are still hard to pass. Type 3, they're probably more formed, but there are still some hard bits throughout. Type 4 is ideal. It comes out smooth. Type 5 is sort of fluffy a little bit, but still smooth, easy to pass. Type 6 is more mush, and type 7 is just liquid. So we want it to be type 4 to 5 every single day, passed easily without any other symptoms. So a related misconception is also that children cannot be constipated because they're having diarrhea or loose stools or accidents in their underwear. However, this is actually fairly common with more severe constipation, and we call this overflow diarrhea. So check back to episode 1, so part 1 of this series, to understand why constipation happens and what's happening in the body. But just a quick review, when the new poop is forming and enters into the large intestine, where the poop that we often see in the toilet is forming, what happens is that the new poop, which is liquid, is entering the large intestine And while that large intestine, or the colon, has building up poop in there, hard poop that's getting drier and drier with time because it's sucking out the water, this new poop comes and actually bypasses, and then it actually leaks. And often this is not felt, or it's felt just in the nick of time, where kids will say, oh, I really gotta go, and then they rush and they reach the potty just about in time, or sometimes it ends up in their underwear. So this overflow diarrhea happens when liquid stool from higher up in the gut is pushed around a solid blockage of constipated stool. The treatment for overflow diarrhea is actually the same as for constipation, to get kids moving their bowels more regularly and to clear out the solid poop that is caused by the blockage. Utilizing both medication and lifestyle strategies is often the way that we go about this. So the lifestyle strategies is what we're going to dive into further here. Now, question 2. When a child goes into a corner and bends over or squats into a particular posture, maybe looking like they're straining, they are trying to poop. True or false? Usually this is false. And what I'm trying to get at in this example is that we often see children exhibit withholding postures when they're constipated in order to prevent themselves from pooping as a result of fear that they will poop and it will hurt, as mentioned earlier. This withholding will actually exacerbate the constipation symptoms further, driving that constipation, although the younger child cannot make this connection. This is where it becomes important for parents to understand and to be aware, so you can guide your children through this accordingly, depending on their developmental age and their level of understanding. So far, we've mentioned a few times that constipation can be caused or worsened by children purposefully holding their poop. When constipation is caused by the child's behavior in this way, this is called functional constipation. And why does functional constipation happen? Well, we've already touched on a few of the points, but here we're going to dive into one big one, which is routine changes and stress. I like to encourage my parents to think about when they tend to get constipated. Perhaps it's on a trip, or there's been a routine change, or they haven't been on a routine, or they're eating more pre-prepared meals rather than home-cooked meals, as some examples, or even other dietary changes. Similarly, in children, at times where their diets, activity levels, daily routines change, or they experience stressors, they can also develop constipation. So it's often an opportunity to check in. So, as we focus on early childhood years, there are often some key times where constipation is more likely to start. And these are, 1, when starting solid foods for the first time, as this is a dietary shift from breast milk or formula to foods that are iron-rich and solid. It may be important to think about starting foods that are also high in fiber, like beans, which have fiber, protein, and iron. Another is when they are toilet training for the first time, and thus learning to hold and control their urinary and bowel functions. Their initial attempts at withholding stools can result in constipation. Once they become constipated, the stool may be harder to pass and even more painful. And this initial feeling of pain can sometimes become associated with stooling, thereby making the child experience some stress around stooling again, resulting in further withholding, which can exacerbate the constipation. Another time is when starting school. Often, when the routine changes, there are new demands, including academic, routine, and social demands, and this can also come with emotional shifts and stress. Other stressful changes include when a new sibling is born, during an illness, because children will often have reduced appetite that can result in not enough intake of water and therefore dehydration, further driving the constipation, and even with changing of the seasons. So we're starting in the summer months, we tend to see a cycle of constipation emerge again, which some of that can be related to more activity and more sweating. So keep on top of the fluids during this time. Recently, I've noticed constipation to be generally more frequent, anecdotally in my practice, related to being on screens. So this is a really important point that I'm going to be making here. So please pay attention. Studies show a link between screen use and other sedentary behavior and constipation. And I find that children can become very fixated on screens and withhold to keep on playing, because those games are often intended to keep you on. And this can potentially disrupt them checking in with their own bodies on whether they now have to go to the washroom or not. Therefore, it's really important to be mindful of the time that children spend on screens and following screen time and healthy screen use recommendations, and ideally, even reminding them to take potty breaks from time to time. As a reminder, no screen use is recommended under the age of 2 unless it's, FaceTiming with loved ones, so there's an opportunity for connection there, and less than 2 hours above the age of 5. But it is important to be mindful of the quality of that screen use to promote education, movement, and connection, and to not allow it to displace other more meaningful activities. These can include physical activity, time in nature, time with loved ones, education, that sort of thing. The Canadian 24-hour movement guidelines also recommend not only movement, but limiting sedentary behavior. Sedentary behavior alone is a risk factor for disease as well. And, of course, constipation, the topic of discussion. So what can parents do about their children becoming constipated? I like to encourage parents to take a step back. I do this myself when my children become constipated because it's inevitable often. I just take a moment to pause, take a step back, and think about the daily routine. The most obvious and direct habits are around food and drink, but there may be some other things that contribute, like the schedule, routine, emotional stressors, and other stressors, to name a few. So let's start with the most obvious. What are they eating? In order to have regular stools, it's important to have a fiber-rich diet. And this again aligns with Canada's Food Guide recommendations for a healthy plate. Fiber-rich foods include vegetables, fruits, beans, legumes, nuts, seeds, oatmeal, whole and not refined grains such as those in whole wheat bread, millet, quinoa, farro, etc. Apart from preventing and treating constipation, there are numerous other health benefits of having fiber as well, including a whole field of research is supporting this, building a healthy gut microbiome that affects the health and well-being for a child's entire life, so into adulthood. So this is one of the reasons that Canada's Food Guide recommend more plant sources of protein in that quarter of the plate and the whole grains in the other quarter of the plate. Meats do not contain fiber, and ultra-processed foods have lower fiber content in relation to other aspects as well. But, with food, there is no one-size-fits-all either. Many of us still rely on processed foods like breakfast cereal. In our household, we certainly have a type where we've looked at the nutrition label. It's got a higher iron content, higher fiber content, and the lowest sugar content. So there are ways to navigate so that you are maximizing the health benefits while minimizing the ill health benefits when you're making some deliberate decisions around the choices that you are making for food. If you haven't checked out the ultra processed food episode, please do check it back out on the Parenting is a Lifestyle YouTube channel and on any places where podcasts can be found. In one study published in 2024, ultra-processed foods were associated with a higher odds of developing constipation, and the odds were lower with foods that were minimally processed, leading to the recommendation of ultra-processed foods being limited, as well as supporting Canada's Food Guide recommendations of having more unprocessed or minimally processed foods to achieve healthy bowel habits. Next, consider what your children are drinking. Water is important for constipation prevention and management. Having a water bottle available throughout the day and serving water as the drink of choice at mealtimes can also be helpful and also aligned with Canada's Food Guide. Particularly if it will be a warm summer day and they are out running around, be sure to have adequate water to make up for some of the losses from sweating. It's not just water though. Look at what else they're drinking. In particular, excess dairy intake can be constipating, and the recommendations are 500 to 750 mils max a day, which is 2 to 3 cups equivalent of dairy, which includes milk, cheese, and yogurt. Are they being active? The gut is a muscle too, and keeping active helps the gut move, so poop will pass through rather than staying put. When we are sedentary throughout the day, like sitting on our desks, it can increase the likelihood of becoming constipated. Similarly, for kids, holding it in can encourage constipation. Some kids are also so busy in a task they feel they cannot go to the toilet during the day, so they hold it. One systematic review published in 2024 found that moderate to high levels of physical activity significantly reduced the risk of developing constipation, and a lack of physical activity potentially increased the length of constipation episodes. What is the daily routine? Do they wake up and go to the potty? Do you schedule in potty breaks or just let them go whenever they feel the urge? One really important tip, especially as children are developing an interoceptive sense of fullness and emptiness in their gut, is to assist in strengthening this connection. There's a reflex called the gastrocolic reflex, which is an important reflex that increases the movement of poop through the gut to make room for new food that's coming through. So this reflex results in the urge to poop after a meal. That means after the child has a meal, ideally have them sit on the toilet to take advantage of this reflex because they will often feel the need to go. If they don't, just have them sit as part of a routine. Have a meal, sit, non-stressful activity for 5 or so minutes after they eat. And as they keep doing this in a stress-free way, they will ideally build a routine and stool more regularly. If the daily routine is going to shift, try to make sure to stick to a stooling schedule as well that is in line with what your child normally does. And keep in mind, this can shift according to a sleep-wake cycle. So jet lag can affect this as well. If you're not able to keep a schedule around pooping, you can fall back on sitting on the toilet for a few minutes stress-free after every single meal to keep that connection going, that gastrocolic reflex continuing to take advantage of it. There are other factors, as I alluded to earlier, such as sleep, which occurs on a 24-hour circadian rhythm where hormonal changes can actually affect the way your GI tract will work, among other processes in the body. In a meta-analysis, sleep disorders were found to be associated with an increased risk of constipation, both in children and adults. Stress and emotional states, such as new siblings, stressors in the home, exposure to adverse childhood experiences, these can all affect children's stooling behavior. This includes stress around toileting, toilet training, accidents, and using shaming words like negative words related to poop, such as smelly, dirty, bad, etc. So trying to emphasize positive words around pooping, as we discussed in our previous episode, is really important as children build a relationship between their poops and their daily bowel habits. Kids can also become stressed related to stooling when it comes to the pain associated with stooling, as I've mentioned a few times. So mindful breathing can help. One thing I do with my little one when she becomes constipated is sitting with her and taking mindful breaths with her on the toilet. I call these mindful pushes. If you're not relaxed in the bathroom, it can be really difficult to stool. Moreover, screens, while they can sometimes help with distraction, they could potentially disrupt their developing interoceptive sense of being full and emptying their bowel, similar to the way a screen disrupts intuitive eating. So we'll talk about this in a future episode. Next, you can take stock of your own bowel habits. Do you prioritize your toilet break? Are you being mindful as well of stooling, of what you're eating and drinking, the timing of it all? Prioritize your poops and you will likely prioritize those of your children as well. And remember, stooling is part of normal physiology and negative words should not be associated with them. And when toilet training, it's important to be mindful that while it can be frustrating, keeping your child internally motivated rather than externally motivated with rewards is also really important. For example, stooling helps them feel empty and happier and ready to eat another meal rather than having tummy pain, feeling more fussy and irritable. So thank you for joining us on part 2 of the Functional Constipation series. I hope this was helpful. Be sure to sign up to our newsletter on parentingisalifestyle.com. Be sure to follow along on this podcast on YouTube and on Spotify and other places where podcasts can be found. Join the community of lifestyle parents on Facebook. This is a non-judgmental space where our motto is, it's never too early, it's never too late to build healthy habits, so start today. Please do not hesitate to rate, comment, and share as this helps support the podcast and our community. And let me know what topics you'd like to hear more about. Until next time.
It's never too early, it's never too late to build healthy